During the summer of 2024, I remember specifically first at cheer camp, we always had to run laps around the gym. And I was like, oh my gosh, why can't I catch my breath after running laps like I normally can?
Eva had a heart surgery when she was 11 months old at Children's Hospital for a hole in her heart that had to be repaired. Their recommendation was just follow up every year with the cardiologist, just make sure everything's good.
We really just sort of observed her. Her aorta was always a little bit larger than it should be for someone her age and her size. When I saw her in 2024, it had gotten quite a bit bigger in a fairly short period of time. And it was at a size where it was concerning now. When I saw that, I said, she must have some sort of genetic abnormality to cause this aorta to get this enlarged. It doesn't happen by itself. One of the very fortunate things about working here at Geisinger is that it's integrated. So we work with a lot of other people, and it's very easy for me to get some help. So I needed that help from genetics, and our geneticist team is outstanding.
Dr. Mangano's ordering that test allowed her to be identified with important mutation in the gene called ACTA2. Eva's the 61st case in the world that has this particular mutation within ACTA2 gene that causes smooth muscle dysfunction syndrome. Eva has a specific mutation that causes the syndrome that she has. That syndrome not only affects the aorta, also affects the arteries supplying blood to the brain, so patients can have strokes at very young ages, and it also affects the muscle cells in other organs.
It was a shocking diagnosis. It was shocking, but we had to get a game plan in place. Like, okay, she has this condition. She's going to have this surgery to fix this aorta.
When she met with the surgeon, he asked her if she had any questions.
And she said, my only question is, will I be able to go on roller coasters again?
Obviously, there's some limitations, like with cheer, I couldn't do I couldn't stunt, I couldn't tumble. Nothing with G-force, I can't go on anything G-force related, like no roller coasters. And I love roller coasters, so that's kind of sad. I get winded so easily, and I feel like the normal person, like if you just meet me, you wouldn't know that like I had heart surgery or I have this condition or anything like that.
At the time Eva was born, no one even knew about the condition. It's an extremely rare condition, and so the only way to understand the condition is through research.
I think that the genetic testing can save lives. It's just very exciting. It's a very exciting time that we live in with what can be discovered with the human body.
We're also at a point in history where the potential for very innovative therapeutic options is now as high as it's ever been. So different types of cell and gene therapy may be able to actually cure some of these diseases. And in Eva's case, there is work being done to develop gene therapy approach to potentially curing smooth muscle dysfunction syndrome. So it's very exciting times in terms of developing new treatments.
With this cure, like it's gonna be life-changing for everyone who has like this condition. So they don't have any limitations, they can just keep doing what they want to do without having anything holding them back.
She doesn't live any kind of a victim life at all. Her genetic condition of MS-MDS is part of her life. It's part of her story, but it doesn't completely define her. Even for someone with Eva's very rare genetic condition, we know that she is safe and well cared for with the Geisinger team. I would definitely not be afraid of medical testing and the science. I would be encouraging of it because the more you know, the more power you have.
We would have never known how close Eva was to being in serious trouble without having that test done. And thank God we did.
Yeah, for a thing we'd never heard of, ever.
Eva's story and the way she lives her life should be motivational to all of us engaged in patient care and in research, because she's a perfect example of how research can profoundly affect one's life and help them in facing health challenges that they have.